Hi friends, another common question being asked to me is this: can I go for non-surgical rhinoplasty? My parents are scared about general anesthesia, sir. Very pertinent question. But non-surgical rhinoplasty gives non-permanent results. Non-surgical rhinoplasty is a simple procedure where we take fillers and inject mainly on the dorsum, okay, mainly on this area. So if you're having a bump here, or if you want this height to be increased, it works well. That's the advantage of non-surgical rhinoplasty. The real big disadvantage of this is it is not lasting long. It lasts for just a few months. All right, you got to go back and then get the injection done again. Go back and then get it done again. And this is going to be done once every 6 or 9 months, to be very honest. Therefore, does it have a role? Yes. But please be aware that when you go for that option, you need to recurrently go and get it done as and when you feel like, and it's going to also cost you. It's not very cheap because you got to use good fillers, otherwise it can have other issues with non-surgical rhinoplasty. Okay, the other thing about, very often my parents are scared about general anesthesia. Now let me tell you this: it's more safe than taking an aeroplane, than taking a flight. It's safer than riding on the roads, especially in this incredible India. It's really safer than that. So I think people have to understand this. You have to educate your parents. Remember, they come from an era where it wasn't that safe. General anesthesia wasn't that safe in India 3 decades ago. It wasn't this rampant. Now we have so many hospitals, so many technologies, so much safe anesthesia like sevoflurane, for example. I mean, it's revolutionized so much of our general anesthesia, and hence the fear that your parents had with these procedures, considering 30 years or 40 years before, was true then. It's not true anymore. I remember this thing that happened to me when I was in Africa not long ago, a few years ago, and they said, patients don't like to come to the hospital in Africa for cosmetic surgery because they think hospital is a place where dead people go, or it's like you go there and then get dead or you die. So it's for serious issues. This is the psyche of the patients, of the people there. So we are also a developing nation, and therefore they're right in their thinking. But the youngsters in India, we are all really educated, a lot of us, and it's up to us to educate them. And once you tell them the truth, and then that fear is behind them. Okay, so do not consider non-surgical rhinoplasty just because your parents are scared for general anesthesia. Right? That's the first message. Does non-surgical rhinoplasty have a role? I already said it does in select issues, in select patients, in select individuals who have a profile like that. Now, the other issue with non-surgical rhinoplasty is it cannot address all types of rhinoplasty, all types of nose changes. Let's say you have a very wide base. You can't do nothing with non-surgical rhinoplasty. A lot of our patients in South India especially have broad noses. They want to get that little narrowed down, slimmer. That's not going to work with non-surgical rhinoplasty. So really the role for that is also limited in the South Indian population. Next thing is the thickness of the skin. As the thickness of the skin increases, it's not a great procedure again. So there are a lot of things that are not so good about non-surgical rhinoplasty. There are not so many things that are not relevant. Yes, it's popular because everyone today wants to get quick fix solutions. You want to get McDonald's burger quickly, but unfortunately it's not the best for a lot of patients. I've had patients who've come after a couple of injections over 2 years. They've not been satisfactory with the results. I've also got patients who've been satisfactory with them. Let's say you are in the show business, you're doing something in TV, you're in Mumbai or you're in Delhi or Bangalore. Yes, I mean, that is an option you can consider. You don't have time at all. So then, because surgical rhinoplasty, remember, not only requires a little bit more money, but more importantly, it requires a little bit more time. So if time is a concern for you, yes, go ahead for non-surgical rhinoplasty if you're a right candidate for that. And then when you have time, schedule for a proper regular rhinoplasty. And very often the umpteen number of people can do non-surgical rhinoplasties, but it's not the same for surgical rhinoplasty. The skill set, the experience for two is a huge difference. So you've got to look at that as well and then make a decision. All right, thank you.